Pralidoxime, something I wish I never would have to come in contact with. It reverses inhibition of cholinesterase. It is permanent, and it is the antidote for pesticides or chemical warfare. It comes in an auto-injector. You're going to want to give yourself atropine first, though. In adults, you're going to do it IV. You're going to titrate it. Make sure you give the atropine first because it's going to be real extreme if you don't. They do have a loading dose for children, and there's an entire protocol based on body weight. It does not cross the blood-brain barrier, but there are lots of important side effects, and the interactions and contraindications don't really matter because you're poisoned and you're probably going to die. So use this. It'll cause blurred vision, diplopia, dizziness, drowsiness, headache, pain at the injection site, and transient increased liver enzymes. So make sure that the airway is maintained because this attack is going to increase secretions. You might have to vent them first. Make sure that you wash them and yourself and all of their clothing and their skin with sodium bicarb or alcohol. Get that off because it is absorbed through all routes. Make sure your infusion is slow. Make sure that you have something at the bedside for potential seizures. Now remember that this is used to reverse the central nervous system effects. So the concomitant atropine will be used to block any type of muscarinic effect, but it will alleviate some of them. It'll alleviate some of the salivation and bronchospasm, but we are most worried about paralysis and respiratory depression or respiratory distress.